I would like to, I'm sorry that I cannot speak in French, but first of all, I would like to thank the organizers, the French Academy of Medicine, for this opportunity, not only to show our findings, our service, our results, but also to see new experience, to exchange experience. I think this is one of the most important things. And I would like to show you about this telehealth network of Minas Gerais. Minas Gerais is a state in southeast Brazil. It's very near São Paulo and Rio, and it's a region of mountains and of mining. So Minas Gerais is something like general mining. And we have a lot of mountains and a lot of valleys. So we have in each valley a small city. So we have more than 800 small cities, most of them with 10,000, 7,000 persons, small cities with difficult access to medical assistance and health assistance. This is also a historical state with, from the cycle of gold in the 18th century. And there is a feature that is very typical, very important, is that we have huge inequalities in the state. It's somehow a small portrait of Brazil itself, because the south and the east, closer to São Paulo and Rio, are richer, also the west part, but the north and northeast are very, very poor. So we have on one state very different situations in terms of access to health care and access to specialized care. So more than 10 years ago, we received a grant from the State Agency for Research to implant and to test the feasibility and the cost effectiveness of a telecardiology service. Mostly ECG. In the beginning, we began with 82 small cities. They were spread in the state, in the north, in the south, in the west part. And we ran since the beginning a consortium of universities. We choose to provide low-cost technology, use low-cost technology to give ECG, and in a few months later, teleconsultations for all these 82 cities. And this was very, very well succeed. So in the following years, this program, in the beginning a research project, but soon a program, became spread in the state, and we did successive waves of expansion. We included other universities, and we moved from only cardiology and ECG to other methods, to other fields of medicine, and even for other fields of healthcare. And we are now present in almost all cities of the state of Minas Gerais, 811. And we are also present in other states, mostly with the telecardiology service. So now we are providing assistance for these 800 cities in Minas Gerais, of them in the public health care system, with more than 1,000 telehealth points, but also points inside the ambulances, especially in the north region of the state, in the primary health care centers of the city of Belo Horizonte, which is the capital of this state, this 20 million persons state. But we also are present in other cities of other states. The numbers are larger now because we are implanting this expansion. We pretend to be present in 11 Brazilian states until the beginning of the next year, mostly with the ECG system, with the support of Health of Ministry. And we are present also in a pilot project in the Amazonian river from Peru, in the Santa Clotilde Health Center. It's a pilot project in another country. We are funded by several different partners. Most of them are public. So the Ministry of Health, the state of Minas Gerais, the city of Belo Horizonte, other federal agencies, research agents, Brazilian research agents, but also NIH and the European Commission, and also some charities like Medtronic Foundation with specific projects. And we expanded our activities to many different fields. We still have ECG and cardiology as our main service, but we perform other exams. We do fundoscopy for ophthalmology, Holter and echo, as other cardiac methods. We perform teleconsultations, and we do projects and services in health. We have a branch on teleeducation with online courses, online classes, and we perform research mostly in implementation research. We believe that, as many of the previous speakers have told, the main issue now is not only to have the cure for disease, new methods of diagnosis, but to have access to everyone. So we have to change the way we do research, and we are doing mostly implementation research. Also some big data, since now we have a considerable amount of data from these sources. And we give support for all these activities, the quality of the reports and the activities, but also the technical support for the ECG machines that are spread in the whole state. The telecardiologist is the strongest service. It's provided in a web-based platform. We have cardiologists on duty not only in Belo Horizonte, but they are everywhere in all these partners, all these university partners. And we answer the ECGs in the same day. We are working until July only the commercial time, but we are beginning to work 24/7. We developed a web-based system that can capture the ECG signal from different brands, and we developed a report system that it's not so sophisticated, but similar to what LifeTrack showed here. It has some intelligence. It does the automatic measurements, and it suggests and can show for the cardiologist they have some intelligence on it, trying to avoid errors. Because when we do a lot of diagnosis, the big challenge is to avoid misdiagnosis, erroneous diagnosis, and we have all this audited, they are audited, and we care about the quality of these reports. We do the same thing for ophthalmology in a much, it's much less frequent, but we acquired the image now mostly from specialized care centers, and we give the report in at least 1 to 2 days. And we perform teleconsultations. We do mostly asynchronous teleconsultations. We had in the past some experience with online teleconsultations, but they are very, very expensive. And we decided since the beginning to provide low-cost technology and things that can be done almost everywhere in these small cities, in this very, very large state. So these asynchronous teleconsultations, it's a web system that we developed that the physician or the nurse can write the clinical case and which are their doubts, why they are asking for a question. And we have on-duty specialists, general internal medicine, pediatrics, nursing in other fields, and they answer these questions generally in the same day, but something like 15% of these questions should be forwarded to an specialist, so they answer in at least 2 days. We also do direct teleconsultations in case of epidemic. We had yellow fever, for example, in the beginning of this year in the state of Minas Gerais, and we open a hot site and people can get material, educational material, but also to talk with a specialist very, very quickly. We also used these teleconsultations to organize the flow of patients. And then in some regions, in some cities, we established these teleconsultations for regulation of access to specialized care. Before being forwarded to specialized care, the primary healthcare physician has to fill this teleconsultation, trying to show that it's really necessary to forward this person, because we know that we have a lackage of specialists, but we have also to qualify the way this limited resource is being used. We have a very high rates of satisfaction with the service. In almost 80% of cases, it avoids the referral, and the referral is cost because these small cities have to have an ambulance or car to send the patient for the other cities. The health professionals are very satisfied with this, and generally the teleconsultation answers the question, and the people are satisfied with the answer. We have good numbers. We performed since the beginning more than 3 million ECGs that are in our database. Of them, digital ECGs, we performed more than 100,000 teleconsultations and smaller numbers of the other diagnostic methods. We have these tele-education activities, and in the last 2 years, we evolved from standard platforms to use YouTube and other social media, and this we had a boost in the access and the use of our educational resources since then. An example of activity that include all these issues, research, assistance, implementation science, is our programs related to myocardial infarction networks. We know that this is the first cause of death in most countries. In Minas Gerais is also the same situation. So we did, in the beginning, in 2 different regions, an epidemiological diagnosis. We developed solutions that are tailored for each of these regions. For example, for the north region of the state, a poor region, we developed an ECG that works in tablets, as we see here. Very, very important. We have several meetings with the stakeholders, the health department of these cities, and we established a flow that was not a flow of a mind of a person, but a flow that was discussed with all these partners. We trained all these health personnel, and we, since the beginning of the project, we monitor the results. And we show in these 2 regions, in the city of Belo Horizonte and the north of Minas, a reduction of mortality related to myocardial infarction after the introduction of these programs. We know that these mortality rates are very, very high when you consider Europe and United States, but we really got some major improvements in hospital mortality with the beginning of these systems. We do also in-person trainings, and we believe that telehealth is not something that you establish and not go back to the place. You have to be in contact with the health professionals, the health department, and the persons very closely. And we also evaluated the amount of money we spend in all these projects and assistance activities. And considering the referrals are being avoided, we did 2 large studies about the economy of these activities. And since now we have a very, very high return on investment. It's for now something like 5-to-1. When you are a large service, the costs are much lower. And so you can scale up, you can have something much more efficient. I'm asked to show some key points of our experience, and I try to summarize them here. First of all, you can have your ideas, but you have to go to the place to evaluate the local needs. What is the epidemiological profile? What's happening there? You have to trust in evidence-based interventions, and considering that the most important challenge is to have access to these interventions that most of them we know. For cardiology, for example, we have a lot of evidence. We should try to choose simple, low-cost sustainable technology. We generally use the ECG equipment that is available, the PC that is available. We do not need, for most of these cases, any kind of special investment. It's very important to use management tool for monitor results and to guide new actions. We try to use the best planning methods for doing what we do, trying to be efficient. We work in close partnership with the public health stakeholders, and we are inside the public health system. We are not trying to do something over the public health system. We always use a multi-professional, multidisciplinary approach, and medical doctors, nurses, pharmacists, physiotherapists are involved since the beginning. This is an example of integration between research, development, assistance, in-service education for those health professionals, but also academic education. We have many PhD and master students involved in all these activities, and we are working in networks always, not only inside the state of Minas Gerais, but when we are working in other states. So I have a film for the ending, but only to say that it's possible. We are trying to show that we achieved some kind of use of telehealth to improve universality, equity, equality, and integrality assumptions of universal health care. We are trying to get innovative products and to do this cycle of getting a research and to develop an app or a system and to get it included in the public health system. It's not always working, but we are trying to move the cycle in a virtual way. And we consider that this model is possible to be used in other places, and we defend this. Obviously, we are not doing this alone. We have a very large team, more than 100 persons involved. Besides me, it's Maria Beatriz Alquimim, who was the chief of all the services, while I was the director of the hospital in the last years. But we are working together with many, many persons to get this. And I would like to show an example of 3 patients inside the telehealth network of Minas Gerais, and I will ask for these movies. I think it's there.
The Telehealth Network of Minas Gerais provides telehealth services for remote cities in 4 Brazilian states. Recently, we have also been working to implement telediagnostic services in Peruvian Amazonia. The network develops innovative solutions to provide remote support to health professionals, to improve the quality of health care, and to reduce the feeling of professional isolation. In November of 2017, an 85-year-old patient was admitted to basic health unit in Zapori with very slow cardiac rhythm. The electrocardiogram was performed in the unit by a healthcare provider. The telehealth system connected the remote unit to our telehealth center in Minas Gerais. In a short period of time, the patient's ECG was analyzed by our cardiologist on duty, who reported it as an emergency to the local team. A pacemaker was then implanted, saving the patient's life. wide availability of mobile phones, use of mobile technology-based interventions is a promising strategy to stimulate weight loss and to promote behavioral changes in obese and overweight patients. The Telehealth Network of Minas Gerais conducted a study showing that implementation of a simple mHealth text messaging intervention focused on behavioral change in obese and overweight patients in primary care is feasible and potentially effective in reducing body mass index, systolic and diastolic blood pressure, as well as in encouraging changes in lifestyle. A 38-year-old patient living in Belo Horizonte, state of Minas Gerais, was diagnosed with hypertension, obesity, and a psychiatric disorder, and received text messages providing information, advice, positive reinforcement, and motivation. At baseline and at 4 months of follow-up, clinical assessments showed reduction in body mass index, waist circumference, hip circumference, weight, and systolic and diastolic blood pressure. The northern part of the state of Minas Gerais in Brazil is a large rural area with considerable social inequalities and a population of low socioeconomic level. A computerized decision support system was developed for hypertension and diabetes in the Health Rise Brazil project. This application provides reminders, alerts, and assistance to diagnostic and therapeutic plans. A 61-year-old hypertensive patient living in the city of Ladainha was evaluated 3 times during a 5-month period. The Health Rise team provided advice on healthy meals and on physical activity, referred the patient to psychological support groups, requested laboratory testing, and made changes in medication. After the intervention, clinical assessment eventually showed control of blood pressure. The study helped to better understand gaps and barriers in diagnosis and treatment of cardiovascular disorders and of diabetes. The Telehealth Network of Minas Gerais is in its mission to improve quality of health care in underserved areas.